Hello, I'm Tatiana Malia, a BSN student. Today I'm going to talk about the best practice for preventing pressure ulcers. As we all know, pressure ulcers could interfere with our patient's healing process. This problem does not only affect our facility, but it affects all facilities across the country with patients with mobility problems. Pressure ulcers occur across all healthcare settings and can interfere with persons' quality of life by causing complications such as chronic pain, infections, and body deformities. A descriptive study by Rich and his colleagues in 2010 covered 9 Maryland and Pennsylvania hospitals with 269 subjects who were aged 65 and older, bedbound, elderly, hip-fractured patients. According to the study, pressure ulcers are common complications of immobility among elderly, resulting in substantial pain, suffering, and excess hospital costs, with charges for associated hospital stay averaging over $15,000. A systematic review done by Reddy and his colleagues in 2006, which included 59 randomized controlled trials, estimated that in the United States acute care facilities alone, almost 2.5 million pressure ulcers are treated each year. The overall costs for hospital-acquired pressure ulcers range between 2.2 and 3.6 billion US dollars. We all know the standard practice for pressure ulcer prevention is turning bedbound patients every 2 hours. But is this the best practice? Does it really happen? One of the common used ways of pressure ulcer prevention is the frequent manual repositioning of patients with limited mobility. According to Rich in his study 2010, several clinical guidelines recommend that bedbound patients should be repositioned every 2 hours, but there is little evidence for its effectiveness. The study recommends frequent repositioning together with the use of other pressure relieving surfaces such as special mattresses and cushions and heel protectors. DeFlo and his colleagues in the study in 2004, they did an observational study of 838 patients for 28 days, examine the effect of different turning intervals on occurrence of pressure ulcers. According to the study, turning every 4 hours on pressure reducing mattress in combination with pressure reducing positions and cushions resulted in significant reduction in the number of pressure ulcers. A descriptive study by Guningberg and his colleagues over 5 hospitals in 2 Swedish county councils stated other pressure ulcer preventive strategies used more often are risk assessment at admission, provision of pressure relief mattress to the higher risk patients, use of heel protectors and chair cushions for prevention. Current evidence shows that the best practice for preventing pressure ulcers is the use of support surfaces such as the special mattresses with turning every 2 hours and regular repositioning of immobile patients. Altogether makes it the best practice for preventing pressure ulcers.